So in DNBs, I'm sure MS is going in the OS case base, but DNE many 2 or 3 times they've asked this aseptic loosening, and the hip joint they have asked, if I remember correctly, and in the knee joint also they've asked aseptic loosening. So it is coming in your exam. Uh, for fellowship exam in England, it's almost mandatory to have one case of a aseptic loosening of hip joint, which is very common here. So what we're going to do is a series of 3 lectures. Today is very basics of aseptic loosening, the basic concept or basic science concept of it. And then next week we'll talk about aseptic loosening of the knee and hip joint as a separate topic, one each, where we will go through cases, how they present and how do you investigate and how you should manage it. Okay, is that all right, Neha, Abhishek?
Okay, sir.
Yeah,
Yes, sir.
yeah, you can both unmute yourself if you want to. That's fine. So, Neha, what do you understand by aseptic loosening?
Mm, it means like loosening of the implant without any infection, sir.
Excellent. Yep. And Abhishek, you want to rule out what is your understanding?
So same thing, sir. It is non-infective loosening, and but in out here mainly it's there to because of wear of the particles, sir. That is the primary
Okay.
reason.
So let's say you've done a hip replacement a month ago, and the patient had a fall with a nasty B2 type periprosthetic fracture. Uh, so and it's sunk. The prosthesis has moved because of the fracture. Will you call that a aseptic loosening, Abhishek?
No, sir. It is that will not be called as aseptic loosening.
What will be that? Is that a loosening?
Yes, sir. It will be losing, but aseptic losing is mainly, sir. It is a gradual process. I don't. It's not a acute.
Okay, so if you want a very literal definition, that is a loosening, and that is also aseptic. So one more thing you have to say, it is not related directly to trauma. Okay, so the definition of aseptic loosening is this. Neha, can you read that?
Yes, sir. Aseptic loosening is a complication that occurs when a prosthesis looses from bone without infection or trauma.
Yeah, so that means basically every time you see a prosthesis and you're thinking of aseptic loosening, you have to rule out that this is not directly related to trauma or an infection. So that's a definition of it. Yeah. So aseptic means without infection. So every time you have to rule out infection or a direct trauma. And I'll come to there's a confusing B3 periprosthetic fracture. Abhishek, do you know how we classify periprosthetic fractures?
Yes, sir. I can't
But have you heard of
enumerate it right.
Vancouver
Yes,
classification?
sir. Yes,
Yeah,
sir.
yeah.
Yes, sir.
Yeah,
Yes.
so in that classification, well, very simple is that A is trochanteric fracture not involving the processes stem, B is around the process, and C is away from it. Yeah,
Yes, sir.
yeah, and then B further classification is done whether the prosthesis is stable or unstable or how's the bone quality. So sometime the B3, which is mean bad bone quality, and then it's broken, that could be actually either it could be periprosthetic fracture or it could be osteolysis leading to significant bone loss and then led to fracture. So that's a bit confusing about the B3. But generally, if a significant trauma, then you can't call it a aseptic loosening. Then you call it a periprosthetic fracture. Okay,
Yes.
although it's aseptic. So first is how do you define aseptic, and then second is how do you define loosening? Aseptic mean not sepsis, so you have to try everything to rule out infection. So whenever a case
So
come,
just
first,
a so just a second. So, but
yeah,
in B3, what you meant periprosthetics, B3, sir, isn't it that the first the implant is already loosened and then the trauma occurs and then the fracture is there? So,
yeah. So implant is loosened, and because it is loosened because of it is not infected, Yeah, and it is because of the wear particle that bone quality was bad.
Yes.
Yeah.
Yeah.
Yeah, and that's why the B3 is you also have to do something to improve the bone quality. It may not necessarily be because of the particular disease. It could be sometime it could be because of stress shielding. Sometime it could be because of osteoporosis. So not every bone resorbing condition is a wear related condition, but is one of the commonest is that in B3 is that it is a long term where you leads to osteolysis, and osteolysis, because the bone quality is so bad, you're absolutely right, it could be that it has loosened first and then broken, but it is also possible that patient had no symptom till it actually breaks. Yeah.
Yes.
And then
Yeah.
it's
Yes.
confusion is whether you call it a periprosthetic fracture, whether you call it osteolysis, but it doesn't matter. Treatment is same. So there's a bit of overlap in diagnosis of there. So asepsis is easy to say because there was no infection, and loosening is a bit difficult thing. So Neha, do you know what do you mean by loosening when you say aseptic loosening? How do you define loosening?
uh, that like implant and bone contact won't be implant and bone contact will be lesser,
Less,
something
yeah.
like that.
And how do you know it is less? Oh, well, not less, but it
Like
has it has
instability.
moved it has moved from its original position.
Hanji.
Okay, what loosening mean? Whatever position you put, you may have put it in wrong position, doesn't matter, and it may stay there without loosening. But whatever position you put it, if it has moved, that means loosening, isn't it?
Yes, sir.
Yeah, and because it has lost the fixation to bone or cement, and then it has moved from that position. Easy to understand the concept, but sometimes very difficult to interpret on X-ray it is moved or not. And that's why the gold standard is that you should have a serial X-rays whenever you want to say about loosening, or there are criteria, and we will discuss that when we're talking about aseptic loosening of hip and knee. What are the criteria to define loosening? So, for example, in total hip, we will have Gruen zone and we will Lee Chanley zones, and we will say how much is the osteolysis, which probably can give you a hint that it's loosening, or whether the stem is in varus or an inclination changed or torsion changed, or it has gone medially. So we will define all that when we're talking. But loosening is sometimes a bit difficult to if you got just one X-ray because you don't know whether it's moved or not. There may be significant osteolysis, but the implant may not be loose. Yeah, so you have if you're talking about osteolysis, then that's easy to see in the X-ray. But if you're giving a diagnosis of loosening, then you have to tell me that it is loosened because it has moved from its original position, and for which you need to know the original position. Okay. So loosening is not easy. It is that's why you need a detailed history from patients, especially about the pain. When the implant get loosened, there's a particular type of pain you see, especially in the hip joint. Do you know, Abhishek, what will patient present with loosening? What kind of pain?
Typically, sir, that pain is there throughout, sir. It's not
No, that's the difference between this and an infection. This pain is called startup pain.
s- startup.
Okay. It's a startup pain, like you are sitting and then you start walking, and if it is in the thigh, then it is most likely a femoral component is loose. If it is in the groin, that means most likely your acetabular component is loose. But it start up, and once you start walking, it kind of wriggle itself and settle in a position, and then you don't get pain. So, but when first time you stand, when you loosen, it just move a bit more, and then the movement become less as you walk. So that's why it's called a startup pain. Yeah. So you need to that history, then an examination, then you do some lab test. Mainly lab test is to rule out infection, although nowadays we're getting more some more blood test to see whether it's causing osteolysis. So there are marker for osteolysis and osteoblasts.